Hi, good afternoon. Last week, I met my friend. He came to me saying that he's having a headache for the past 6 to 7 months continuously, on and off, actually. He went to many surgeons and many automations and many clinicians. He took 4 or 5 times MRI, CT, X-rays and all. He went for many tests also, some other tests also. They mainly suspected him for migraine, actually. Actually, many people and many surgeons they told it is not migraine. When some of the doctors they told it is migraine, he got confused whether it is migraine or not. Some people told it may be a tension headache or something. Of course, it is directly related to tension. I can understand about him because he is working for a corporate company. He is a lawyer. He is working for a corporate company. He used to deal with many cases, many employees like this side, many clients that side, and corporate cases one side. All these things. Heavily he'll be dealing with cases. So every time, each and every hour, he'll be busy with the work schedule. Plus, always each and everything is important for him. So he concentrates a lot. So he'll be seems to be tensed. So whenever he gets tensed, there is a possibility of headache. Fine, I can understand that. So after met with me, I asked his all the tests, all the things, what are the things he is having, the recommendations from the doctor's side. I went through this carefully. I saw that MRI, CT, all the tests are done. And I personally assessed him. Actually, the MRI was clear, the CT was clear, all the other tests was clear, completely clear. And again, I also got one suspicion actually, because I know what was possible. So one little bit suspicion because he is always dealing with the cases, he is busy. Uh, then he may be developing this tightness in the cervical region. That's what my concern. So I was speaking to him about his job. When I entered into the topic related to his job, slowly he started to develop tension. So slowly, after 5 to 10 minutes, he started to develop tension. I started watching him clenching his teeth, continuously grinding his teeth after getting tense. And he's having his muscles, all these muscles are protruding outside. Then I got the clue actually. He got this headache because of Bruxism. What is Bruxism? Bruxism means grinding and rubbing of teeth unknowingly. When we get tense, we are not consciously doing it, but unknowingly, involuntarily, we'll be clenching our teeth, grinding our teeth, and we'll be pulsating our teeth, or we will be making some noise inside our teeth, but like biting it one by one. Like that, we will be creating some noise or something. That is called bruxism. In short, grinding of teeth. That is bruxism. So when somebody is having bruxism, that is involuntary grinding of teeth, they will be producing the tightness of this temporomandibular joint, especially the muscles, masseter muscle, pterygoid muscle, and temporalis muscle. These muscles will go for tightness. The masseter muscle, the temporalis muscle, and the pterygoid muscle, which is present over here. These muscles will go for tightness. When these muscles are getting tightness, ultimately the tension will be irradiated towards the side of the neck, nape of the neck, and to the back of the neck, especially to the neutral line, upper cervical region, neutral line. So this is going to happen, right? So when this is continuously getting tension, the upper cervical region, when it is going for tightness, we have C0, C1, C2. And the outlet of C1, C2 nerves that is going to supply to the scalp region, the head region. And if that is going to affect it, ultimately you will be having irritation of the C1, C2 outlet, I mean spinal nerve root. So that may cause headache. So that is indirect reason. So we can say indirectly jaw clenches headache. Jaw clenches headache because of breath suck. So when they clench their teeth, it's called bruxism. It develops indirect tightness to the side of the neck plus backside of the upper back of the neck. That will develop the contraction of the upper neck region. That will irritate the C1, C2 nerve outlet, and that which is supplying to the scalp region. That is going to produce some pain in the head. To confirm that, I asked him, what do you feel when you are having that pain? What kind of pain you are having? He clearly explains that the pain is like I'm tying a strap in the hip, like strap like pain. Like I feel when somebody is tightly fixing or tying a strap on my head, how it will be like that. I have a pain like this, strap like pain. Like it's a clear indication that it's tension dependent, but which is developed due to cervicogenic. So it is a direct relation. The cycle goes like this. It clenches the teeth because of tension, indirectly, I mean, unknowingly. Because of that, it develops upper cervical tightness. Because of that, it develops impingement of the, I mean, a tightness of the upper cervical region. Because of that, indirectly, impingement of the C1, C2 nerves, and which is going to supply to the scalp region and upper cervical region. And if that is affected, ultimately he is going to have that pain. Okay, this is the case scenario he came. What I did, I found this and wanted to treat him because as he is my friend. Wanted to treat him. I wore a gloves in my hands and I put my thumb in the slightly, I opened it here. I put my thumb inside the mouth, oral cavity inside. I used my thumb to palpate the medial surface of the right temporomandibular joint inside from the oral cavity. And I palpated like this, slightly I opened the mouth. So I got to directly the access to the masseter region, the temporomandibular region, medial region. So pterygoid muscle plus masseter muscle within this thumb and the second finger. So I got rubbed over that. I got a trigger point, I found it, and I tried to started to release it. I started to release the tightness inside. So slowly, he said, initially when I pressed over there, he replicated the symptoms. He said, all over the area, wherever I have the exact feedback, now I'm reproducing that like that, he said. So I was started to release that. Slowly, when I starting to release that, he said, my pain is actually reducing. The same way I release it to the opposite side also. I have another choice. Suppose if it is worse enough, I'll have a needle and I'll put it inside the temperament bladder little bit. I'll slightly open it, put it inside closely, obliquely, posterior and superior region in that region, in that direction. I'll insert the needle, which is directly going to access to the inner deep trigger point of the masseter muscle. So in that way also we can release it. But anyway, I try to release, we have to release the spasm and the tightness and trigger point of that masseter group of muscle, I mean TMJ muscles. Okay, especially masseter, pterygoid, temporalis muscle. After releasing this, I started teaching them meditation, breathing exercise, and mind local stretching exercise for them. Opening, yawning like stretch, yawning like exercise. I started to teach him and I gave him little exercise to strengthen that also because he said whenever he tried to open up the mouth a little bit, I felt he felt like something clicking sound inside. So I felt that the joint, the muscles are little bit weak. So I started giving him some strengthening exercises. So that means meditation, relaxation exercise, then breathing exercise, some strengthening exercise. So this is how I finished it. And I advise him not to go for that much deep inside the cases and all. So not to get tensed. So this was my final advice. So thank you for watching.